Canine Distemper, Pathogenesis, Clinical Manifestations, and Prevention. Canine distemper remains a significant infectious disease affecting dogs worldwide, despite vaccine availability. This comprehensive review examines the disease's epidemiology, clinical presentation, and modern vaccination strategies. Understanding canine distemper. Canine distemper is a highly contagious viral disease that affects domestic dogs and numerous other carnivorous species. The condition results from infection with canine distemper virus, CDV, a paramyxovirus that shares genetic similarities with measles virus in humans. Despite decades of vaccine availability, canine distemper continues to represent a significant health threat in unvaccinated or inadequately vaccinated dog populations. The disease is characterized by its ability to cause multi-system infections, affecting the respiratory tract, gastrointestinal system, nervous system, and skin simultaneously. Understanding the nature of this pathogen and its transmission patterns is essential for veterinary professionals and dog owners seeking to protect their animals from serious illness. Viral characteristics and transmission. The canine distemper virus spreads through respiratory secretions, making airborne transmission the primary route of infection. When an infected dog coughs, sneezes, or engages in close contact with susceptible animals, viral particles are dispersed into the environment. The virus can also be transmitted through contaminated food, water, and fomites, though respiratory transmission is typically most efficient. Young puppies, elderly dogs, and immunocompromised individuals face heightened susceptibility to infection. The virus incubates over several days to weeks before clinical signs become apparent, during which infected animals remain infectious and can unknowingly spread the disease to other dogs in their vicinity. Clinical presentation and progression. The clinical manifestations of canine distemper vary considerably depending on the viral strain, the age and immune status of the affected animal, and the specific organ systems involved. Initial symptoms typically include fever, lethargy, and reduced appetite, followed by respiratory signs such as nasal discharge and coughing. Many affected dogs develop gastrointestinal symptoms including vomiting and diarrhea, which can lead to rapid dehydration. The disease is notorious for its secondary complications, as the viral infection compromises immune function and allows bacterial opportunistic pathogens to establish secondary infections in respiratory and digestive systems. Key points: early systemic phase, fever, depression, anorexia, and lymphadenopathy. Respiratory manifestations: rhinitis, pharyngitis, and productive cough. Gastrointestinal signs: vomiting, diarrhea, and abdominal discomfort. Integumentary involvement: hyperkeratosis of nose and foot pads. Neurological complications and persistent effects. Among the most challenging aspects of canine distemper is its potential to affect the central and peripheral nervous systems. These neurological manifestations may occur concurrently with systemic symptoms or develop weeks to months after the initial infection. Some dogs develop seizure activity, tremors, or involuntary muscle contractions that can persist long-term or become progressive. The development of neurological signs often indicates a poor prognosis, though survival is possible in some cases. Additionally, some infected dogs that recover from the acute phase continue to shed virus and may develop chronic neurological disease, making management and prognosis unpredictable in affected individuals. Diagnostic approaches. Diagnosis of canine distemper requires integration of clinical findings with laboratory confirmation, as clinical signs alone can be nonspecific and overlap with other infectious diseases. Veterinarians may identify characteristic lesions such as hyperkeratosis of the nose and foot pads, which are relatively pathognomonic for the disease. However, laboratory testing provides definitive confirmation and guides treatment decisions. Various diagnostic methods are available to practitioners, including immunological assays that detect viral antigens in respiratory secretions, cerebrospinal fluid, or other tissues. Reverse transcription polymerase chain reaction, RT-PCR, offers high sensitivity and specificity for viral nucleic acid detection, enabling early diagnosis even during the incubation period when clinical signs may not yet be apparent. The DA2PP Vaccination Series. The foundation of canine distemper prevention rests upon vaccination with multivalent immunological preparations. The DA2PP vaccine represents the standard core vaccination regimen in modern veterinary medicine, protecting against 4 critical pathogens with a single administration. The first component protects against canine distemper virus itself, while the A2 designation indicates protection against canine adenovirus type 2. This particular adenovirus type also provides cross-protective immunity against the more pathogenic canine adenovirus type 1, the causative agent of infectious canine hepatitis. The vaccine designation includes 2 P letters representing protection against canine parvovirus and parainfluenza virus, respectively. Some veterinary practitioners utilize the expanded DA2PPC formulation, which includes an additional C component targeting canine coronavirus, though this component is considered non-core and is frequently omitted from standard vaccination protocols. Vaccination protocol and immunological response. Establishing protective immunity against canine distemper requires a carefully structured vaccination schedule that accounts for the declining maternal antibodies in young puppies. The standard protocol involves administration of multiple vaccine doses at specific intervals, typically beginning at 6 to 8 weeks of age and continuing until puppies reach 16 weeks of age or older. Revaccination at 1 year of age reinforces immunity before transitioning to a maintenance schedule. The frequency of booster vaccinations for adult dogs has become a subject of ongoing research and professional discussion within the veterinary community. While some regulatory frameworks recommend annual revaccination, others support longer intervals between booster doses based on serological evidence of persistent immunity in vaccinated populations. Individual risk factors, local disease prevalence, and lifestyle considerations should influence the booster schedule selected for each patient. Vaccine efficacy and breakthrough infections. Modern canine distemper vaccines demonstrate remarkable efficacy rates, with properly vaccinated dogs showing excellent protection against clinical disease. However, breakthrough infections can occur under specific circumstances, particularly in young puppies during the window between waning maternal antibodies and developing vaccine-induced immunity. Dogs with underlying immunodeficiency conditions or those receiving immunosuppressive therapies may show reduced vaccine responsiveness. Additionally, the quality and storage conditions of vaccine preparations can influence immunogenicity and protective potential. Environmental factors, such as stress and concurrent infections, may temporarily impair immune response development. Understanding these variables helps practitioners optimize vaccination strategies for individual patients and identify animals at higher risk of vaccine failure. Treatment and supportive care. No specific antiviral therapy exists for canine distemper, making management fundamentally supportive in nature. Treatment focuses on maintaining hydration status through intravenous or subcutaneous fluid administration, controlling secondary bacterial infections with appropriate antimicrobial agents, and managing clinical signs as they develop. Dogs with gastrointestinal involvement require careful nutritional support and electrolyte monitoring to counteract losses from vomiting and diarrhea. Anticonvulsant medications become necessary for animals experiencing seizure activity, while supportive care for respiratory infections may include nebulization therapy or oxygen supplementation in severe cases. The prognosis varies considerably depending on disease severity, the extent of neurological involvement, the dog's age and overall health status, and the quality of supportive care provided. Early recognition and aggressive supportive treatment offer the best chance for recovery. Prevention strategies beyond vaccination. While vaccination represents the primary prevention strategy, additional measures can reduce transmission risk in at-risk populations. Maintaining strict hygiene practices, including disinfection of food and water bowls, bedding, and environmental surfaces, helps prevent environmental transmission. Limiting exposure of unvaccinated or incompletely vaccinated puppies to potentially infected animals is crucial, particularly during vulnerable periods before immunity develops. Isolation protocols should be implemented immediately when canine distemper is suspected or confirmed, preventing spread to other susceptible individuals. Wildlife contact should be minimized since many wild carnivores can harbor and shed the virus. Proper ventilation in multi-dog environments and avoiding overcrowded conditions support disease prevention by reducing viral concentration in shared airspaces. Global epidemiology and public health impact. Canine distemper maintains a significant presence in canine populations worldwide, particularly in regions with inadequate vaccination coverage. While the disease has been substantially controlled in developed nations with robust veterinary infrastructure and routine vaccination programs, it remains endemic in many developing countries. Wildlife populations serve as potential reservoirs, and the virus occasionally spreads from animal shelters and rescue facilities to community dogs. Recent surveillance data indicates that vaccination hesitancy, economic constraints preventing access to preventive care, and changing pet ownership patterns in some regions have resulted in increased disease incidence. Understanding these epidemiological patterns helps practitioners identify populations at increased risk and emphasizes the importance of promoting vaccination awareness within their communities. Special populations and risk considerations. Certain groups of dogs require particular attention regarding canine distemper prevention and management. Puppies from shelter backgrounds may have unknown vaccination histories and limited immune development, necessitating careful monitoring and potentially modified vaccination protocols. Senior dogs with declining immune function may benefit from assessment of their immunity status through serological testing before relying solely on historical vaccination records. Dogs with compromised immune systems due to illness or medication require individualized vaccination recommendations, sometimes necessitating consultation with veterinary specialists. Pregnant females infected during critical developmental periods risk transmitting infection in utero or through neonatal exposure. Breed-specific considerations may influence vaccination timing and booster frequency, particularly in smaller breeds or those with known predisposition to vaccine reactions. Emerging research and future directions. Ongoing research continues to refine understanding of canine distemper pathogenesis and immunity. Investigation into duration of immunity following vaccination promises to provide evidence-based guidance for optimal booster scheduling, potentially reducing unnecessary vaccination while maintaining protection. Development of improved diagnostic methods aims to enable earlier detection and differentiation from other infectious diseases. Studies examining genetic factors influencing disease susceptibility may identify individuals at higher risk and guide breeding decisions. Furthermore, research into novel vaccine formulations and delivery methods explores potential improvements in immunogenicity and protection breadth. International collaboration in surveillance and epidemiological monitoring helps track viral evolution and emergence of new strains, ensuring that vaccination strategies remain aligned with current viral characteristics circulating in different geographic regions. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.